post-vaccination. When we look at those numbers and we talk about our post-vaccination rates, we see that of those post-vaccination rates or those breakthrough cases, about 910 of those cases were vaccinated, which is about 1%. When we look within those cases, the hospitalization, we see that about 4% of those individuals who were hospitalized were vaccinated, which is even a smaller percent, 0.04. When we look at the age of those unvaccinated folks who may have had hospitalization or may have experienced flu-like symptoms or COVID-like symptoms, we still know that there's a high number in our 20 to 39 age group where we're seeing more cases of those individuals we suspect have been unvaccinated. And when we look at the race ethnicity, we know that non-Hispanic Blacks and Hispanics are seeing more hospitalizations than what we are seeing in the other race or age ethnicities. And so we've identified those cases. Now, the Clarksburg area is based on the current census, and we know folks are moving in, so the data may not be representative of where we are, but we continue to focus our vaccine strategies in Up County and our testing strategies regarding that. When we look at our vaccinations, we're still vaccinating about 5,431 folks a week and testing just as many. So I'm going to stop there with my slide and just briefly talk about our vaccination strategy. So we've had our vaccination strategy. We've been talking to the county executive. I know we've had conversations with MCPS and mask mandates for teachers and staff, and the county is considering mask mandates for employees who are unvaccinated. If they're unvaccinated, they will be subjected to weekly testing. We are working through that now. We'll present that data, those data points, to the county sitting as a Board of Health. However, we have crafted plans for 3 cohorts, those individuals who were recently identified as immunocompromised, which means that you actively have untreated HIV, you seek treatment, you are organ donor transplant, you have cancer, you're taking a high dose of corticosteroid, just to name a few that I can talk off the top of my head, but it's a very finite set. And we put together a plan based on our data that we have from our Immunet, which is a state system, that there are about 27,000 of those folks who fall in that category. And we have about 23,000 doses. So we're working with state to get guidance. Our current guidance is coming from the CDC. We have a call this afternoon to talk about our proposed plan, but our proposed plan not only covers those individuals who are immunocompromised. You know, we strongly encourage those individuals to talk to their providers to make sure that there's no counterindication based on their treatment, therapy, and or modality, so that their condition does not worsen. Now, within that, we have our plan to vaccinate those individuals who are post 8 months. There isn't an emergency use authorization for that. It is being proposed, and once that is proposed, we're looking at those individuals possibly getting vaccinated in September to late October, based on the numbers that we have. We have the data from our phased approach early on in the year, and we will follow that eligibility guideline. And then lastly, when the vaccine becomes available for individuals under age 12, possibly the Pfizer vaccine, we have a plan in place for that. And so we are going to vet these plans with the Maryland Department of Health to look at how we can realistically approach that. You know, we won't have the mass vac sites again, but we do have projections based on our data analysis when the bulk of those individuals would be eligible for vaccines. And we're looking at, you know, those healthcare professionals, those nursing homes, assisted living facilities, public safety, and then moving into the next cohort, which were those individuals that had a chronic illness who were not immunocompromised, but had an ongoing chronic illness. And so that's the plan going forward. Individuals who received the vaccination in the county will receive an email from C19 vaccinations at montgomerycountymaryland.gov. And that would be an indication that based on our data, an individual or individuals are eligible to receive a third shot. Now, I know we've heard the term boosters, but it's actually a third shot to increase one's immune system to respond to any variant strains. Currently, the Delta variant is a dominant strain, but folks need to keep in mind that the Lambda variant is out there. And as long as these variants are in the community and we don't have herd immunity, which slides based on the length and duration that the virus is in the community, we're taking all those precautions based on CDC guidance to make sure that Montgomery County or county residents are vaccinated and have the highest level of vaccination. The last piece is the Pfizer and the Moderna vaccines have been approved for the immunocompromised cohort that I mentioned earlier. There haven't been any discussions or additional discussions. They're still running analysis and looking at the clinical trials for the efficacy of the Johnson & Johnson. So those individuals who received the Pfizer for 12 and older and Moderna for 18 and older will be eligible to receive that if such indicators suggest that any individual who received an mRNA vaccine, Pfizer, Moderna, or Johnson & Johnson are eligible, or individuals are eligible, then we would administer that. But the preference is to have those individuals to receive the third shot based on their first and second dose regime. I'll stop there, subject to any questions. I know it's 1:56, but I just wanted to provide a snapshot of where we are, the direction the county is going. Individuals should stay safe if they travel to those areas. It's still vacation time. School doesn't start until Monday, and I'm sure folks want to get in. The other guidance that we're providing based on the Board of Health regulations and the letters of approval based on the committee, that when speakers, if you're giving class based on the class size and the location, the current guidance is for individuals to wear their masks, especially speakers. But if individuals are speaking and they're in a setting and they need to speak and remove their mask, but the current guidance that we are suggesting that individuals are still continue to mask. Now when you move into your classroom setting, be it hybrid or in-class instruction, continue to monitor the data that we present on our website, whether or not we are at substantial or moderate risk. If we're at a moderate risk, the Board of Regulation will be rescinded until it goes back until a substantial transmission, and individuals may not have to wear a mask indoors. If it goes back, the recommendation would be again to wear a mask in the classroom. So I just wanted to give you some framework and timeline for the fall to kind of consider as you plan. I will stop there. Thank you for your time and consideration.
Questions for Dr. Bridgers? Stacy?
If classes are in person right now, is he recommending that the instructors and the students wear masks indoors? That's what I thought I heard. Okay.
Maybe you can.
I'm sorry, Fox 5 is outside. Can you repeat the question again?
So students for indoor in-person classes, students and instructors should wear masks?
Yes, that's the current plan now. Now, if the transmission goes down, then, based on the Board of Health regulations, but we're advising all students and instructors to wear a mask indoors.
Mm-hmm.
I have time for one more question before I have to go outside.
Cindy?
Hi, yes, I just wanted to ask a little bit, is there a possibility, just a possibility that MCPS could go back to in-person classes? Go back to online classes only if the numbers are very high in the county?
Well, the current goal is to continue to provide guidance and keep folks in class. One of the challenges for the lower school age individual children is that they aren't vaccinated. And so once we look at the vaccination and we continue to monitor the vaccination rate and get those folks vaccinated, then it will probably less of a risk. But the current plan is now because of them, and then guidance. And we know that, school age, elementary school kids, they may or may not take their mask on and keep them on. So that's pretty much the guidance. The goal is not to return to virtual or hybrid. The consideration will be given to hybrid classes when we see high transmission consistently over a 7-day period. And that's when we continue to go back and make the recommendations to return to a virtual or hybrid classroom.
Okay.
Okay.
Yes.
Thank you so much for
Thank you
squeezing
so
us
much.
in.
Please send me any
Take care.
emails if you have any questions. Stay safe. Enjoy the rest of the summer. Thank you for being the educators that you are.
Thanks so much. Take care.
Bye-bye.
Wow. Yeah, I saw that announcement that Dr. Gales had resigned, and I thought, oh, wow, are we going to see Dr. Bridgers today? But I'm glad he was able to have a few minutes. Any follow-up thoughts to that very whirlwind presentation? I noticed that I was looking at the MCPS back to school plan, and they basically said that they will not consider going back to virtual unless the state says so. But they do have a hybrid backup. So I guess that's what he was saying. High transmission over a 7-day period is pretty much what they're. If we hit that, then that's what will happen. So. Okay, Halima, I'll pass it back to you.
Great. Well, we'll do our breakout group now. I'll repost the question again here. And for the breakout group, I think we can be in there for 15 minutes.
Halima, maybe 10, just for
10 minutes.
so we have time at the end to talk about topics.
Okay. All right, sending everyone off now. Great, welcome back, everyone. I hope you all had a good discussion. So we'll just go by breakout group 1. If you could just share some of the key themes that came out, and then we'll go in that order, 2 and 3.
I don't think we know which group we were in. I mean, I don't.
I think we're number 1.
Pardon?
All right, breakout 1.
I think we're going 1.
Oh, okay. Okay, we're 1. Okay, so they volunteered me to speak. So I think we share probably what everybody shares is that, we wish we could go in person, but there's been so much back and forth and so many challenges that I think most of us are going completely online. I think Rubidia said Impact is going to try, if their space opens up, they may try to have something in person. There's some of the challenges we faced had to do with space availability, but also the limit of, concern for social distancing, concern for, where the volunteers live versus where the space might be available, and possibly the need for recruitment. And also just, if you have to limit the number of students like that, this was something that I kept thinking about. If I can serve 20 students in a class online, but only 5 in person, it's really hard to make that call. We also talked about the challenge of just making the decision And I shared, and I thank Alex. I'm going to thank you right now, and Nancy. I don't know who made the decision, but your decision helped me make our decision, because I felt like, you know, if you guys didn't feel like you could do in person, then I didn't feel like I could either. So because we're such a small program. And there was one other thing that we talked about.
You talked about your creating that community with WhatsApp.
That's right. That's right. Yeah. Thank you, Ahu. So, so that was one challenge also of the online, is I think Cecilia brought up that the students, one of the benefits of in-person classes is the creation of community and the importance and the value of community of in-person classes. I mentioned, as I did previously, that a huge benefit that we gained from this past 18 months was starting to use WhatsApp as a communication tool for the classes. So for each class, we create a WhatsApp group with the teachers, the Zoom assistants, you know, all the, you know, and an administrator, as well as all the students. And the teachers use it, you know, for homework and things like that. But then the students also share things, they share resources and ideas with each other. And then we're also able to share resources with students as we come across them. So for example, you know, all of the different like trainings or workshops or whatever that I receive from you guys, we will pass on to the students, and they've been very, very happy and excited about receiving them.
Thank you. Room 2. That was Alex, Shannon, On, and Garland.
I'll jump in since no one's kind of leaping to the. So we kind of stuck with the question, but I mean, I think we kind of run the gamut in terms of what we're doing for the fall. So Anne's already kind of doing some in-person hybrid classes for the Montgomery College ESOL program. We're looking at hopefully doing some sticking with remote for any classes that start in September, but then hopefully in October for our fall 2, doing a mix of some in-person and remote, kind of depending on locations and if I can get teachers to do it. And then I think for CASA, they're planning on potentially staying with remote until February of next year, and then maybe doing in-person classes. But you guys, Shannon, you're already doing some in-person with your workplace classes though, right?
Yeah, they'll start in the next few weeks for the first time being in person after about 1.5 years of being virtual.
Great, thank you. Room 3.
Okay, in room 3, Shannon's group is going virtual, or is remaining virtual. And Chow Chow is going to have 1 in-person class and the rest are virtual. And I'm having 7 in person and then the rest are virtual. And so we talked a little bit about what in person might look like, reduced class sizes, and just how many days a week are we offering our classes. Some are offering 2 and some are 3 days a week. Did I forget something? I think that's it.
Great, thank you. I'm going to share my slide again with just some of the upcoming MCAEL meetings. I know that with and this has been a theme that has just come up with the uncertainties of planning for the fall, but these are just some of the meetings that we're going to have: October 13th, November 10th, December 8th. All of the meetings are at 1 p.m. and we'll be sending out on the MCAEL newsletter as well as the e-blast with the topics and the information. This is just a recap for the meetings that we had last year for FY20. And a lot of them did focus, it was a split between the network meetings as well as the topics in program administration meetings. So with this part, we want to get your ideas for some of the meeting topics that you would be interested in. We do want to make sure that we are responding to the concerns that are happening in the community, and also making sure that we provide information for your programs, for your instructors, and for your learners. So at this point, if you could please put in the chat some topics that you would be interested to see in the meetings, that would help us in terms of the planning. Just a refresher, these are possible topics for the topics in program administration meetings, and these are the TESOL standards. Within each standard, there are subtitles as well. So if there are things that you're interested in, please put them in the chat as well. Rudy, do we have responses in the chat? I'm unable to see it. Okay.
Not yet. So just to build on what Halima said, over the years, over 1 year, we have about 6 or 7 meetings for program administrators. And the feedback that I have gotten to date is that everybody has appreciated the fact that we have some meetings that are focused on TESOL standard areas of administration, and some meetings are about, county resources that are useful for learners. And so we're going to continue with those 2 types of meetings. There'll probably be about 4 topics and program administration meetings over the year, and 2 or 3 ones that have to do with learner resources. So getting your feedback on this is really critical, because we want to make sure that we are meeting the needs that you see. So.
Halima, can you put the list back on?
Yes.
The first list? Thanks.
This one?
No, the next one. Yep. Thank you.
Oh.
And I'll just read from the chat, since Halima, you can't see that. So Anna mentioned employment training and job search resources for learners. Definitely. Scholarship opportunities for employment training. And a program administration topic that Cindy mentions, assessment and placement. Cindy, is there any particular aspect of assessment and placement that you are thinking about?
Yeah, so right now we're doing most of our assessment via placement test and that kind of thing. I just wanted to see if others were doing more test, what kind of assessments are they doing throughout the semester, not just at the beginning?
So both formal and informal.
Right, exactly. And then how are they determining if the student's ready for the next level? Is it just a test, or is it oral? Is it, right? They do.
Instructor recommendation.
Right. Is it based on them taking a test?
It's
Or is
everything.
Okay.
It's everything.
Yeah.
Great.
Yeah, I think that's.
Thank you. Mental health resources. Okay, that's a good one. I think that we had community, Every Mind a couple of years ago, but that's an important one to touch upon too, again, this year, I think.
I have a question or a recommendation. A lot of the students need help getting better jobs or jobs. So resume writing, interviewing. Could we possibly have a meeting on helping or finding resources for our students for jobs or
Yes, I think that's what Anna was um, mentioning also, employment training, job search resources for learners. Yes, that's a great idea.
Yeah, and if we're able to do that, it'd be really nice to have speakers. So there's, you know, we have such a broad range of ability to get jobs in terms of, you know, so there's education levels, there's and then there's also, you know, they have their status, different statuses. So it'd be nice to have, so I saw somebody mention work source, so that helps with one category of people, but there are other categories that that they can't help. So, you know, having a range of and then I also am curious, are there any classes that are, well, I know MC has classes that are specific to, you know,
Yes.
for customer service. So those kind of things are super helpful as well.
Great. So Ahu mentions that she has there's a staff member who's community resource manager who supports their workforce preparation efforts. Maybe, do you think they might be willing to participate in a meeting? Okay, good. But I think it is time to hear from WorkSource. You know, they have had such, you know, kind of ups and downs, and they have a new head lead person now, so it might be time to invite them. Okay, and I also see a couple of other things here. Learner retention, how to stop losing students in the middle of the semester. That's a perennial for us, and we certainly can do a meeting around that. I see referrals to other programs, and Ahu, by that, you mean?
What I mean by that is that, you know, we do get students that oftentimes we cannot serve, and then we refer those learners based on their needs, or we refer them to other programs. But honestly, I really don't know if they have been served or not. And if there is a procedure or something like that we could have, at least to track. I'm just using Shannon. Let's say if I refer someone to Shannon, I will have no way of knowing if the student has been served, or do you guys understand what I mean? So I don't want to refer someone to another program just to refer that person, right? We all want those learners to be served, but I have no way of knowing, and I don't know. What can we do? You know, I am aware it maybe takes a lot of effort to track, but at least I don't know if there could be an easy way to kind of keep everybody in the loop or something like that. I don't know. I'm just thinking very loudly, but I think, you know, there are those students that we refer, and then I oftentimes wonder what happened to them, you know, so.
Maybe that's a work group idea. Yeah. Thank you. Thank you for that.
No problem. Thank you.
I see we're at time. Sorry, Halima, would you like to close out then?
Sure, yes. I do want to thank everyone for joining us today. I'm just getting our link for the survey. Like I said, we want to make sure that these meetings are worth your time, they're meaningful, and there are things that you can implement for your programs, with your instructors, with your students. So please do take a minute, if you can, to fill out this survey. It'll take at most 2 minutes. So please do that. And we look forward to seeing you next time for our next meeting.
Thank you. We appreciate it.
Thank you.
Thank you, everyone.
Thank you.
Bye. See you all very soon.